Do you or a loved one currently experience pain in your lower abdomen, or maybe you have noticed changes in your daily bowel habits or bloody stool? So there's a chance that colorectal cancer can be the cause of this. Colorectal cancer is the third most common diagnosed cancer among men and women, with 140,000 new cases reported annually. It is also the second leading cause of cancer deaths in the United States. Due to the formation of cancerous polyps on the inner lining of the colorectal tube, the cancer can easily spread through the bowel wall to the surrounding lymph nodes, tissues, organs, and even through the bloodstream.
Hello, my name is Dr. HQ. I am 53 years old and I have been previously diagnosed again for the second time with colon cancer. A few weeks ago, they found a tumor in my colon this large. I have had a previous surgery where they have removed a tumor, and now I am forced to get this tumor removed again. I smoke and drink regularly, and I have type 2 diabetes, which I've had for the last 6 years. I also have osteoarthritis, and I've had that for 3 years. Since my last diagnosis, I have decided to change my life around. I have currently stopped smoking and drinking regularly. I am also going to start water aerobics, which will help with my exercise weekly intake, and hopefully that will help my diseases.
Characteristics and some signs and symptoms may include changes in your bowel movements, including constipation or diarrhea that don't seem to go away, feeling like you can't empty your bowel movements completely or urgently need to have a bowel movement, bleeding or cramping in your rectum, dark patches of blood in or on your stool, long thin pencil stools, anemia, and unexplained weight loss.
Screening is important in older adults for early detection. A common form of treatment when diagnosed with colorectal cancer is chemotherapy.
Side effects may include hair loss, mouth sores, loss of appetite, nausea and vomiting, diarrhea, increased chance of infections from having too few white blood cells, easy bruising or bleeding from having too few blood platelets, fatigue from having too few red blood cells. Please contact your doctor if you experience any of these discomforts.
Since you last talked to me, you know the previous problems I have been having. But in the last 3 months, I have changed my life around. I have had surgery where they have inserted a colostomy bag and it's working perfectly fine. I have also been doing water aerobics 3 times a week, which has helped me lose weight. Most importantly, I have stopped smoking and drinking and have improved my eating habits.
The comorbidities for colorectal cancer are diabetes, inflammatory bowel disease, previous cancer, cardiovascular disease, and hypertension.
Risk factors are being overweight or obese, physical inactivity, type 2 diabetes, cigarette smoking, drinking alcohol excessively, a diet high in red meats, low vitamin D, hereditary, and being over 50 years old.
So you guys know I have colon cancer. I think you guys should get tested too. It's very important. Did you know that you should get tested after 50 years old and every 10 years after that?
I didn't know.
Oh my God. Tell your friends and get tested.
Oh, colon cancer, why must you attack my colon? Have you pooped today?